You have questions about your labs, especially about your hormone labs now that you are over 40 or over 50, and there's so much miscommunicated, misunderstanding out there as when it relates to lab tests, and I totally get it. So what I did is I pulled the top 7 questions that you left me in comments, in DMs, in emails around labs. So we're going to talk about estradiol, progesterone, TSH, which is part of thyroid, FSH, DHEA, testosterone. We're going to cover a little bit of each of those. If you still have questions about labs, I have an entirely free ebook. It is my lab test checklist ebook. You can find it on my website, drcarriejones.com, under the free resources. You can also find it in the description below, completely free. And I list out hormones, the levels of like the basic stuff and then the advanced stuff. So that kind of level. I go through lipids. I go through thyroid. I go through nutrients. I go through like really cool stuff. If you've tested everything, like what else might you want to test? If you've tested nothing, where should you start? So make sure you grab that free ebook. It's all yours. Having said that, I love answering your questions. So let's absolutely get started. Number 1, Michaela asked, what is my progesterone level supposed to be? I still get my period at 45 years old, got hormone testing, and my progesterone is 6. Is that good? So 6 is usually 6 nanograms per ml, ng/ml. So I'll just add that. When we're looking at progesterone, let me explain the menstrual cycle really quickly so you know where we are. So when you get your period, that's day 1. That's considered the start of the follicular phase. The follicular phase is day 1 of your period all the way through to ovulation when you release the egg. Through that whole time, your progesterone should be very low, like 1 or lower on a lab test. Then you release the egg and your progesterone starts to climb up like a mountain, peak like a mountain, and come back down again until you get your period, assuming you're not pregnant. Now, here's where you need to know about like progesterone testing. We test in that second half. We test when it's in the mountain phase. Ideally, we try to test like as like your mountain is like the highest, but we don't always nail it based on your cycle. So when we're looking at progesterone ranges, we tend to like a range that's between 3 and 20. Some labs will say 5 and 20. Either way, you're a 6, which means you're above 3 and you're above 5. So sounds like you did ovulate, you release the egg, and you're making progesterone. Can't make progesterone unless you got the cells to like after ovulation to make progesterone. But you're asking, where should you be? This is where it gets a little bit tricky on those 1-day tests because I don't know if your 6 is a 6 all the time, which is not great. Ideally, you'd probably want to be between 10 and 20 when you're at the peak of your mountain, right? But you could be still climbing up the hill of the mountain. Maybe you got your blood test on a day that was just at the start of the mountain or the end of the mountain. So you're like, yeah, 6 is where you should be because you're at the either end of the mountain. If you had tested in the center of the mountain when it's at its highest, maybe you would have been 16 as opposed to 6. And I would have said, that's great too, because that's the highest part of your mountain when you should be very high. So this is where it can be a little challenging of like, well, Carrie, what do you like? Well, I like you're at the top of your mountain to be between 10 and 20, but I don't know where you are. And so that's why you're going to make sure when you get your blood draw, it's after ovulation by about 5 to 7 days. And be aware that a 1-day test may not give you the greatest answers because it is just a 1-day test versus maybe doing a test that's like every day, for example, and you can plot along on a graph or a chart. So back to your original question, is 6 good? Could be, but I don't have all the information to know. It at least does indicate you released an egg and you're making progesterone, which is great. And you didn't say you're on progesterone. So I'm assuming if this is from your own body, 6 is good. Number 2, Jennifer asked, my doctor just ran my thyroid and my TSH, thyroid stimulating hormone, is 3.9. He says that that's in range and won't run other markers. I'm assuming she means like free T3 and free T4. I've read that that is not an optimal range or level. What do you think? All right, when we're looking at TSH as a reference range, usually depending on the lab, it's like 0.5 up to 4. Some labs are 0.5 up to 5. When we're looking from a like functional optimal type of range, I do like it closer to 2, and you're at 3.9. So when we're talking TSH, TSH comes from the brain, the pituitary, and talks to the thyroid in your neck. And TSH, the easier it communicates, then that number is usually closer to 2. So if TSH is just like, hey, thyroid, do the thing, make a hormone, make T4, make a little T3, then it'll be closer to 2. If the thyroid gland is not listening, then it gets a little louder, gets a little louder, gets a little louder, and now it's above the reference range, right? It's like yelling when it's above the reference range. So with 3.9, you were totally in the reference range. Absolutely. But I would take into account, like, what's going on? What are your symptoms? What have your TSH levels been before? It is hard to answer some of these questions, of course, blindly off of a comment, but these are the things I would ask if you were my patient. So 3.9, a little high for me, but I do have questions. The other thing is TSH can increase. It's like a kind of a false increase after a really bad night's sleep. So if you went to the lab in the morning, but you did not sleep at all last night, that TSH of 3.9 might be a fake out. There's a whole process that can happen that TSH can go, the TSH on the lab looks higher than it actually is. So I would also ask you, how did you sleep the night before the lab test? Which is also good information for you to listen to. If you do not sleep that great and then go to the lab, your TSH might be higher than it would have been otherwise on a good night's sleep. So this is a great case of where I would make sure on the next go round, I would add in the free T4 and the free T3. I would also, of course, always ask symptoms, family history, and consider adding in the autoimmune antibodies, depending on what your answers are. Number 3, Ray says, can FSH go up and down? FSH is follicle stimulating hormone. It was a 3 on day 2 of my period, but now I've skipped 3 cycles and it's a 13. I got my period last weekend and my FSH was now at a 6. Yes, FSH can absolutely go up and down. So FSH, follicle stimulating hormone, comes from the brain, and much like TSH talks to the thyroid, FSH talks to the ovaries, to the follicles on the ovaries. If it's an easy communication, if FSH is like, hey, follicle, I'm going to need you to do the thing, grow a follicle, make some estradiol, and the follicle says, absolutely no problem, I got you, then FSH tends to be below 10 in the single digits. So 1, 2, 3, 4, 5, 6, 7, 8, 9. We love a single digit FSH when it comes to communication back and forth. Once it crosses into the double digits, so for example, she skipped her period for 3 months and her FSH was a 13, that tells me the communication from the brain down to the ovaries is getting harder. That the brain is now like raising its voice to the follicle. Hey, do the thing. Why aren't you listening to me? So it like ratchets up. Then the follicles did listen. She got her period, started over again, and it dropped down to a 6. That is not uncommon. We use FSH for a few reasons. We use FSH for fertility a lot. We check for FSH levels a lot. We also use it to test if somebody is postmenopausal, especially if like they've had a hysterectomy, they have a progestin IUD, they had an ablation. We'll check an FSH because technically an FSH above 25.8, some labs will say above 30, is considered postmenopausal. So as you start creeping up and you get above 30 or 25.8, then I'm like, oh, you're postmenopausal. So for her to go from a 2 to a 13 to a 6 because she had a cycle, she didn't have a cycles, and then she got her cycle back, I'm like, yes, that can happen. Absolutely. This is why we have to do, if you're tracking FSH for whatever reason, and I don't know why she's tracking FSH, she didn't say, this is why multiple is important, because depending on what your cycles are doing, what's happening, it can bounce around. Number 4, Anonymous asks, how do I know if my estrogen level is too low? I have the 0.05 milligram patch and my estradiol is 56. I did have a 0.1 milligram patch and my estradiol was 85. And my doctor said that was too high and dropped my patch dose. I liked how I felt at the 0.1 milligram way better. I don't like this 0.05 milligram. All right, when it comes to blood draw, serum levels, estrogen, and like if it's too high or too low, right now what we have are your symptoms and bone health. That's kind of all we have to go off of. And what I mean by that is, do we know what level of estrogen, estradiol, is ideal to help protect you against osteoporosis and osteopenia. Research is pointing towards like the most optimal would be an estradiol level above 60 picograms per ml. So PG/ml. Obviously, some research says above 40 would also protect bone, but like the most ideal would be above 60. We don't have research to show what your estrogen should be to protect your brain or to protect your heart, for example, or like anything else. All I have is bone health and your symptoms. So if you felt better on a 0.1 and that blood level was 85, that is higher than 60. If you were my patient and I had your full history and I was okay with it, I would have been fine with that. Now, for this anonymous person, I don't have their full history. I don't know the reasoning as to why if doctor put them back on the 0.05 patch. There could have been other reasons. But in my experience, 85 in a blood draw is not too high. If you felt amazing, weren't having any issues or side effects. They didn't mention anything about progesterone. If she has her uterus, good chance she's on progesterone as well to protect against thickening, which is called hyperplasia. But if we just leave that whole conversation off the table and just talk about the estrogen aspect, I don't feel that 85 picograms per ml, feeling as good as she felt, is an issue. So this is a case where I would say, if you feel comfortable, go back to your practitioner and say, why? Is it only you felt it was too high? Was there anything else that stood out? Because you felt the best at 0.1 and maybe want to go back to 0.1. All right. Number 5. Katie said, at what point do you test testosterone, Dr. Jones? I've asked my OBGYN a few times because my libido sucks. And she said I'm too young to have low testosterone and lab testing for that isn't accurate. And then she goes on to use very colorful language and how she's very displeased with her doctor. So Katie, remember, it's your health. So you can have these conversations with your doctor. But if you don't feel like your doctor is listening to you, like anything in your life, don't feel like you have to stay there. If you want to add to your clinical team, if you want to find somebody else, get a second opinion, please feel free to do so. Now, let me answer your question about testosterone. At what point do you test testosterone? I test testosterone. I'm a tester. That would not be an issue with me. I like to test. I will say, when you test testosterone, the instrument they test testosterone on matters. So you want to make sure your doctor does check what's called a mass spec. It'll be abbreviated MS. So it might say, like a lab will say, testosterone, total, MS. That means mass spec. So that's the most accurate. And there is a kind of a big push for lab testing for hormones to get entirely moved to mass spec. The problem is mass spec is very expensive. So not all labs can afford to upgrade from what they have, which is called an assay, up to a whole lot of mass spec instruments. I mean, that would just cost astronomical amounts of money. However, it is an option. You just have to pay for the fact that you've upgraded to mass spec and you're not doing an assay. So when your doctor says it's not that accurate, I get it. On an assay, it's not. On a mass spec, way more accurate. So that's an option first and foremost. Second, when I'm testing testosterone, we look at total testosterone, free testosterone. We can look at the bus that drives it around. It's called SHBG, sex hormone binding globulin. So when we're looking at total testosterone, and I just took like average ranges. So the average range for a total testosterone for most labs is like 2 to 45. Which is a big range, right? 2 to 45 nanograms per DL. So NG/DL. Free testosterone is less because we have less free and available. That's 0.2 to 5 picograms per DL, PG/DL. So total. So you'd want to be in that 2 to 45 range. But like if you have no libido and you're not feeling well, if you've never had your testosterone run before, like let's see where you're at. And do you need more? Do we need to add that in? And then let's see what your free is. And then let's see what that SHBG is, sex hormone binding globulin. Because if it's high, it's binding up all your testosterone. But your original question is, at what point do you test? I test. I'm a tester. I'm okay testing. So ask again about testing, or consider maybe ask if you have another doctor on your healthcare team. Maybe you asked your primary care who said that, maybe ask your OBGYN, etc., and see if you can get that answered. Number 6, Alex wants to know, what's the difference between testing DHEA and DHEA-S? I see people on social media talking about DHEA-S. S stands for sulfate. But my lab order says DHEA, no S. And do I need to go to the lab in the morning or fasting for hormone testing? So we kind of got a 2 for here. So we have DHEA and DHEA-S. So DHEA is what we call a prohormone. The body prefers to put a little S on it. So the majority of DHEA you make in your body gets S. It gets a DHEA-S. So, and DHEA-S does not follow a circadian rhythm, meaning it's not high in the morning and low at night. So a lot of healthcare practitioners prefer DHEA-S because it's low maintenance. You just go, whenever you're at the lab, you get your lab test done and test your DHEA-S. Plus, because of that S, it gives you an indication of what we call sulfation. Can you put the little S on? Some healthcare practitioners test both. They will do a DHEA and a DHEA-S and compare them. DHEA, no S, does have a circadian rhythm. It should be tested in the morning, first thing. You can test both of them in the morning at the same time, of course, but definitely don't do it on your lunch break. Don't do it if you have like a 2 o'clock afternoon appointment. You want to do DHEA first thing in the morning. And then some people are like, no, I just want to see the DHEA because DHEA, no S, goes on to make other hormones downstream eventually, such as testosterone or estrone, which is one of the estrogens. So I want to see that. I want to put the money towards that. So I don't know what your practitioner was deciding on why they chose DHEA. Sometimes they meant to check DHEA-S. Sometimes the lab, be aware, the doctor or practitioner will check a box, DHEA, DHEA-S, and the lab will flip it. They won't realize it's 2 different things, or everybody does a DHEA-S. So even if you check the box for DHEA, they do the one with the S on it. So you do kind of have to make sure, like, talk to your practitioner and then make sure the lab knows, like, for sure which one was checked on the box or which one is being ordered. Now, as far as do I need to go in the morning or fasting for hormone testing, in general, we suggest go in the morning. And because you're probably getting other lab work with it, like glucose or insulin or cholesterol, you have to be fasting for those. And most of the time, like, your thyroid is on there as well. So you're usually like fasting for thyroid. We just want to be consistent, I guess. Not everybody feels this way, but it's kind of like, in general, this is what we see. It's in the morning and it is fasting. However, if you are at the lab at lunch, if your appointment's at 3 in the afternoon and your practitioner says, we're just checking estrogen or we're just checking progesterone, that's fine. Like, you don't have to necessarily be fasting or you don't have to be in the morning, but I do like consistency. So when I have people go to the lab, I'm like, let's be consistent. Let's always do it in the morning. And it's a little more helpful for me, a little bit more apples to apples. It's not perfect, but it is a little bit helpful in that regard. Last question, number 7. Jayla says, is there a lab test for perimenopause? I have my physical next week and I feel like crap. Hot flashes, moody as hell, gaining weight, not sleeping. I'm dry as a bone down there. Tell me what to test, Dr. Jones. I love it. Well, as I said in the very beginning, this is like the perfect way to end the 7, because I do absolutely have a free ebook checklist for labs that you can have. It's in the description or, of course, on my website under free resources. But her main question is there a lab test for perimenopause? There is not. How do we determine if somebody is perimenopausal? It's age and symptoms. So if Jayla is that age and she's having these awful symptoms, it's like, congratulations, you get a certificate, a crown, a stamp, something that says you are perimenopausal. Now, just because there's no lab test to tell you if you're perimenopausal doesn't mean you don't need labs. I still want to see what's going on. So I still want to see things like your heart markers and your glucose markers, your inflammation markers, maybe some hormones, your thyroid, nutrient markers, vitamin D or iron, B12. it all kind of depends on how long have I been seeing you? Do I have old records of yours? Have you had this run before? Have I been tracking these for a while? Is this all brand new and you've never done it before? Are we just testing one thing, like a quick follow-up? So it's all on my checklist. But for her, for J-Lo, who's like, I clearly haven't had labs, I need a lot of help, I'm going to suggest, like, let's, like a car wash, like, let's get the works. Let's get the works, because you don't feel good, and we want to make sure, like, what's happening. We know the hormones are probably a hot mess, but remember, as women go through perimenopause, it can impact all 12 systems of the body. So I want to make sure we're looking at a lot of systems to help you feel your best. Because why? Hormones feel like herding cats. I get it, and I'm here to help.